We now know that prevention is much more important than early detection. If a woman comes into my office and has a breast lump the size of my pinky, it's been in her body for 40 cell divisions. It consists of nearly 900,000 cells, and on average has been in that woman's body for 7 years. So early detection is not good enough. Prevention, prevention, prevention is the key. And that's what our goal is. That's the whole thing that we're trying to do, is prevention. So what do we do for heart and stroke? What sort of diagnostic testing do you do for heart and stroke? Well, the most important is blood pressure, and that needs to be optimized. As I talked to you before, I believe you're on the wrong dosages and the wrong drugs for your blood pressure. But we're going to evaluate that with a very sophisticated device made by Cardiodynamics called the BioZ. I'm going to do that with your next visit. So that's very, very important. The second thing for heart and stroke, we get a baseline electrocardiogram. And because you have a history of chronic high blood pressure, we want to get an echo of your heart to make sure that the chambers of the heart have not been thickening, because that's very dangerous. So a cardiac echo. But the most important thing, sometimes of course we recommend a stress test, a treadmill as well. But the most important thing, believe it or not, for your heart and stroke risk are the blood tests. And the blood tests really represent a lipid fractionation panel, which you've had done before, plus a special test called a lipo-PLA2, immune markers of inflammation, and we do 3 of them: the HSCRP, the IL-6, and we do the fibrinogen. And then the most important single test that tells me what your diet should be, this one blood test, which never changes. You can do the blood test when you're 1 month old, or you can do it when you're 70 years old. And you should have had it done, and you haven't had it done. It's called the ApoE phenotype. Okay? So that completes the explanation of how we prevent, as well as detect on an early basis, heart disease and stroke risk.